Great. So I will now move on to introduce our first speaker. We have Dr. Loralee Boodram, who is the current head of vector-borne diseases at the Caribbean Public Health Agency. She has qualifications in biochemistry, molecular biology, and epidemiology. She served previously as the molecular biologist at the Caribbean Epidemiology Center, where her work focused on the application of molecular diagnostics foodborne and vector-borne diseases. Between 2013 to 2018, she was the program coordinator of the Caribbean Regional Field Epidemiology and Laboratory Training Program. Also based at CARPHA, which is a multi-country, multidisciplinary training initiative aimed at building human resources for health in applied epidemiology. Under her vector-borne diseases portfolio, Dr. Boodram works with regional and international stakeholders on various strategies to reduce the morbidity and mortality associated with mosquito-borne diseases. I now hand you over to Dr. Boodram.
Okay, good afternoon all. I'm just going to start sharing my screen. Today's presentation, as mentioned, will be divided into 3 sections. Okay, firstly, I will be talking you through a brief overview of some of the more prevalent mosquito-borne diseases in the Caribbean and the integrated strategies that we use in their control. Next, Mr. Rajesh Ragoo, who is our Senior Technical Officer of Vector-Borne Diseases, will be walking you through some guidance developed to aid our vector control operators to conduct their work safely during the COVID-19 pandemic. And then lastly, Mr. Peter Williams, Technical Officer, Health Information, Communicable Diseases and Emergency Response, will deliver some considerations for a multi-hazard approach to vector-borne outbreak and disaster management. Okay, so let's firstly take a look at mosquito-borne disease in the Caribbean and some of the key issues for 2020. Vector-borne diseases are caused by the transmission of pathogens such as viruses, parasites, and bacteria, primarily through arthropods and rodents. They're a major threat to the health and economies of societies globally. They account for around 17% of the infectious disease burden globally, and the WHO estimates about 700,000 deaths annually, primarily seen in tropics and subtropics. In the Americas and the Caribbean, there's a high focus on diseases that are transmitted by mosquito vectors. So one of the more prevalent mosquito-borne diseases that we see in the region is dengue, but I'm sure we all remember the Chikungunya and Zika outbreaks in 2014 and 2016, respectively. We also see, to a lesser extent, malaria, which is more restricted to Haiti and our South American CARPHA member states. And of course, there's yellow fever, which occurs in sylvatic and urban cycles. But again, outbreaks more occur in South America. With respect to 2020, we are all very aware of our COVID-19 pandemic. And in terms of public health, we're all very concerned about the co-circulation of arboviruses and COVID-19 and the strain that this could place on our health systems. So in 2020, mosquito-borne diseases are not our only challenge. The COVID-19 pandemic has affected us globally and necessitated changes in our personal lives and our work. As of this week, we're seeing about 30 million cases worldwide with near 1 million deaths. In the 26 CARPHA member states to date, we have over 30,000 reported cases of COVID-19, the highest daily number being seen in early September in Haiti, and then we also have Aruba here reporting the highest incident rate. Let's take a look at some epidemiological data. Focusing in on syndromic surveillance, specifically undifferentiated fever in the less than 5 years and greater than 5-year age group, most cases are largely attributable to arboviral diseases, example, dengue, and then also leptospirosis. To a lesser extent, we will see some malaria, brucellosis, typhoid, and paratyphoid. In terms of the syndromic data that's reported to CARPHA, over approximately 8,000 cases of undifferentiated fever was seen in Q1 of this year. And this is an even higher number seen in Q2, about 11,000 new cases. Focusing in on an example of dengue, our CARPHA member states report to us both in-country lab-confirmed data as well as clinically suspected cases. So again, as we look at the graph, we see an increasing trend between Q1 and Q2. Based on lab data obtained from our CARPHA Medical Microbiology Laboratory, who test samples that are submitted to us by our member states, we have primarily, at the moment, serotypes 1, 2, and 3 circulating this year. So far, with respect to what has been submitted to us, we're not seeing Chikungunya or Zika, and this has been the trend for the last 2 years or so, and that indicates that transmission is either very low or not occurring. As of September 2020, dengue outbreaks have been reported in some CARPHA member states, with the dengue 3 serotype primarily circulating. So note that in 2019, we were experiencing a major regional outbreak, and dengue 3 was again at the forefront there. Just a quick look at the characteristics of some of the major arboviruses circulating in our region. So of course, we have dengue virus, and that belongs in the flavivirus family. It's transmitted in this region primarily by Aedes aegypti and to a lesser extent, Aedes albopictus in some countries. So usually the 4 serotypes are in circulation, and of course the symptoms of dengue fever, usually fever, nausea, rash, aches and pains. And where there is severe disease, we see stomach pain, vomiting, and bleeding from nose and gums, etc. Then also we have the Zika virus, again transmitted by the same vectors. And of course, I'm sure we all remember that Zika is associated with development of congenital Zika syndrome in newborns. Lastly, Chikungunya virus in the alphavirus family, also transmitted by the same vectors. And the symptoms, well, chikungunya is usually not fatal, but it can be painful. And of course, it's derived from the word that means that which bends up. Symptoms include fever, joint pain, headache, muscle pain, joint swelling, and rash. So I'm sure most of us are familiar to varying extents with integrated vector management. Same elements apply, focusing in on integrated mosquito management. And some of the main areas that we look at involve mosquito biology and their reproductive behavior. We want to be able to identify different species as well accurately. Then we have entomological surveillance and monitoring. Here we want to look at the size and the distribution of our mosquito populations. We also want to look at setting action thresholds for prevention and control activities, and that's usually based on calculating our entomological indices. We usually use technology such as GIS technology in order to visualize the spread and density of populations and the location of disease cases, thereby assisting us with risk assessments. In terms of control techniques, we have 3 major ones that we use: physical, biological, and chemical. And of course, we need to ensure that we're carrying out insecticide resistance testing on our mosquito populations to ensure that you're using the most effective chemicals, but also practicing environmental stewardship to reduce the risks associated with using these pesticides. Okay. Then lastly, we want to focus on strengthened multi-sectoral partnerships and approaches involving not only public health, but also areas such as agriculture, education, tourism, legal aspects, planning and development. And of course, notwithstanding, the most important area that I personally think of is the community outreach and public health education with respect to vector-borne diseases. Changing the behavior of our communities is one of the most critical strategies in tackling mosquito-borne diseases. Just a quick highlight on some of those areas mentioned previously. Looking a bit more at entomological surveillance, here we look at both our larval and adult populations, and key to this is the identification of mosquito breeding sites, estimating population numbers. And here our entomological indices such as our Pareto, House, and Catena indices come into play. Another key area in surveillance and determining risk is actually trying to determine whether the virus is circulating, not just in our human populations, but also our mosquito populations. So at the moment, CARPHA has a mosquito-based viral surveillance program where we test adult mosquitoes that are collected through a collected through our member states. And with those mosquitoes, we test a panel of viruses. And the panel includes dengue, chikungunya, Zika, yellow fever, Mayaro, West Nile virus, and it also includes a few non-endemic African viruses, such as spondyweenie virus. Now, why do we actually want to do this? We're trying to determine at what point some of these new viruses actually become introduced into our region. The precedent has already been set by the introduction of Chikungunya and Zika in the Caribbean. In terms of control techniques, three main methods, as we said before: physical control, source reduction. We want to eliminate mosquito breeding sites. Then we have also biological control. Here's where we can employ natural predators to reduce the number of mosquitoes. So we can use guppies, tilapia, etc. Some of the new technologies, which has not really been implemented really in the Caribbean, but we're looking into the feasibility of these technologies for our member states, the introduction of potentially Wolbachia and sterile insect technology. And of course, there's the traditional chemical method of control where we use insecticides. Now, focusing a little bit on disease surveillance in our CARPHA member states. Typically, clinical or suspect cases are reported from sentinel sites, such as local health centers and hospitals at the district or parish level, and that's reported on to the national level. Countries as well collect specimens that are sent for lab testing, both in country and where assistance is needed at the CARPHA laboratory as well. It's important to establish the disease. For example, if we're looking at dengue, is actually in circulation within a specific locale within a country, but it's not necessary to confirm every single case that's detected. It's a waste of lab testing resources. Once we know that we have dengue circulating within a region, no need to test every single case. The dengue serotype information is important in establishing the country epidemiological profile as well as determining risk levels. So the laboratory testing helps us with that confirmation aspect. And in most CARPHA member states, we carry out laboratory testing through ELISA testing or serology, where we look for antigen and antibodies. And also there's PCR, where, for example, we can obtain our dengue serotype information. I do need to point out that in terms of the laboratory aspect, rapid tests, for example, those cartridge-based tests can be used for screening, but because of their lower sensitivities and specificities, they're not really recommended for confirmation. Okay. Now, one of the most effective strategies in surveillance is to use an integrated approach, where we combine different streams of surveillance data to produce evidence-based information for public health decision-making and selecting our prevention and control measures. Now, within our CARPHA member states, this is practiced to some extent, but a fully integrated approach where we combine entomological, disease, and environment or climate-based data is a journey that more or less we are now embarking on. These various data sets can be utilized in spatiotemporal models to produce risk maps for varying time periods that will aid in us planning both the short and long-term prevention and control measures. Now, it's pretty well known that climate change plays a major role in the spread of mosquito vectors and hence increased disease incidence. And more climate is being factored into risk assessments. Effectively, the early warning information that's obtained from information sources, such as this, can prompt early action. Looking in a little more at the health promotion and public outreach or key messages, an example of this is that every year our CARPHA member states and the various regional agencies participate in Caribbean Mosquito Awareness Week. So we all get together and develop varying health promotion messages and disseminate within our communities. For this year, CARPHA's slogan was, "In times of COVID, let's unite to fight the bite." And here we stress that both individuals and communities need to play their part in the elimination of breeding sites and consequently decrease disease transmission. Now, lots of the regional support to CARPHA in terms of our vector-borne disease interventions currently are funded through the European Union. And we have a specific project for Zika and other mosquito-borne diseases, and that is currently in effect and goes up to the year 2023. The overall objective of this particular project is to improve the public health of the Caribbean population through reduction in morbidity associated with Zika and other mosquito-borne diseases. We have 5 different expected result areas, and we are focusing on strengthening the surveillance capacity of our countries, strengthening laboratory testing capacity, and strengthening workforce development in the area of vector-borne diseases. We're also looking at strengthening our vector control programs, looking at improving our health promotion and community education, conducting research, looking into new technologies, and of course, strengthening our partnerships and coordinating across the region to promote the most effective approach. Now, with the emphasis on COVID-19, we do need to say that in terms of what we have observed for the region thus far is that disease surveillance of dengue and other arboviruses has been affected. We have seen a reduction in terms of reporting. We have also seen a reduction in terms of specimens being submitted to us for testing. So what effect would that have? Of course, a slowing of the response time to outbreak situations. Potential outcome, of course, will be uncontrolled outbreaks of dengue and other mosquito-borne diseases. And as mentioned at the start of the presentation, this is something that we don't want because it will further burden health systems that are already compromised by COVID-19. So that is it from me at this point. I'm just going to hand back over to Sheena.
Were there any questions in the panel that we needed to address? So none right now, and there weren't any in the chat as well. So in that case, we will move right along to our next speaker. We have next Mr. Rajesh Ragoo. He is a medical entomologist and parasitologist and a PhD candidate at the University of the West Indies, St. Augustine campus. He currently holds a Master of Philosophy degree in environmental biology with specific focus on spatial epidemiology. His PhD work is concentrated on GIS modeling of vector-borne disease dynamics. He has lectured in courses on biostatistics, GIS, parasitology, vertebrate anatomy, and animal physiology, and has worked as a medical entomologist, parasitologist with the Insect Vector Control Division of the Ministry of Health of Trinidad and Tobago. He is currently attached to the Caribbean Public Health Agency as the Senior Technical Officer for Vector-Borne Diseases. So on to you, Raj. Raj, you can't hear you.
Oh, sorry about that. Is that okay?
Yes, you're good to go now.
All right. So, good afternoon, everyone, and thank you for that introduction, Sheena, and thank you to Dr. Boodram for that very comprehensive overview of vector-borne diseases and vector control, integrated vector management in the Caribbean region. My topic this afternoon, let me just get it up on the screen here. Right, hopefully everyone can see that, and just doing a sound check to make sure everyone is hearing. Yes, you could just maybe just reply in the chat, just let us know that you're hearing properly.
Yeah,
all right, okay, all right. Thank you very much for that. All right, so let's get into one of the hotly requested topics here from our member states, back at CARPHA. I can't tell you the number of telephone calls, WhatsApp messages, emails that we would have gotten here. Persons reaching out to us to say, Raj, we have COVID-19 happening in the region here, and we have vector control operations that has to go on, and the guys want to know if it's safe to go out into the field, and then how do we operate when we're actually out in the field? How do we do vector when we have this COVID-19 pandemic? So what we did is that we got together in the Vector-Borne Diseases department, and we compiled a list of guidelines, a set of guidelines to help with vector control operations during the COVID-19 pandemic. And we simplified it in a way and put it into a 5-step guideline to make it a little bit easier to implement, so that vector control personnel can have a look at these guidelines then and in a simplified form, look at how to implement vector control operations on a country-specific level. And that's basically the background information from these 5-step guidelines. So I'll start. I see the chat is lighting up here, so I can't see it from my end. Okay, all right. So, okay, so step 1, out of these guidelines, we try to make it. I'll try to make it very, very simple and this afternoon, and hopefully you'll have a lot of questions at the end of this section. Step 1 is to do a weather assessment, and this is against the backdrop of coming out of the dry season or the drought period into the rainy season and the hurricane season for a lot of countries, and we've already had some reports from countries saying during the drought period there was a lot of water storage. There was very, very little pipe-borne water available in some places, and persons were forced to store water. And this then, we realized, led to a large increase in the mosquito populations. And then that springboard into the rainy season and the wet season. And then we had some countries reporting, as Laurelie mentioned earlier, dengue and dengue circulation already in several of our member states. So advice then, starting with step 1, is to do a weather assessment. What I have on the screen here is an example of weather forecast from Trinidad and Tobago Meteorological Services. And this is a 3-month forecast. It's a dated forecast. I'm just using it as an example. And this goes from April to June 2020. But just right at the top, just look at the type of information that you get. The first line tells you mixed conditions, likely drier than average conditions, favored across most of the areas for April to June. And this is for Trinidad and Tobago. Yeah. So it's telling you right away, if you're working in vector, you have some time. If you're doing field operations and you have drier than average conditions before you get into the rainy season, where you can start doing some on-the-ground vector entomological surveillance and vector control. It goes on to give you some key messages below that, such as, the month of March produced rainfall deficits. April is likely to be drier than normal. And then it gives you the rainfall outlook for a 3-month period from April to June, which shows a mixed period. Below that, it says the chance of an early onset to the 2020 wet season is low. And again, this type of information for vector is very, very, very useful, because it lets you know then, and getting into the wet season, into the hurricane season, you have some time that you could be on the ground doing some work. Yeah. Also, things like the temperatures, I think is very, very useful to vector. If you have temperature information, if it's hot, it's very, very hot, and dry conditions, and you're going into a wet period, rainy season, and it continues to carry that hot trend, what happens is that it translates over to the developmental period of developmental cycle of your mosquito vectors. And oftentimes what we find is that when you go over from a hot, dry period into a hot, wet period, you get very, very quick development of the mosquito through that developmental cycle, and you end up with a lot of adult mosquitoes in a very short space of time. Yeah. So some of the key messages here. Some of the key messages here is that this type of information should guide the types of vector control responses over the next maybe 3 months or so, and as the COVID-19 pandemic progresses. Pay attention to short-term or weekly weather forecasts, as well as the medium-term forecasts to be able to adequately plan your entomological investigations. So in terms of entomological surveillance, and I'm just using this to set the backdrop for discussing this against the COVID-19 pandemic. On the ground, entomological surveillance should be timed and phased such that it coincides with periods of dry weather that intersperses the wet periods. So again, where you have that break in your weather, you want to be able to time your on-the-ground entomological surveillance. And it's very, very important for vector control to continue over this period doing entomological surveillance. If we drop the ball in this area, we're going to end up in a lot of problems because you don't have then that real-time data, entomological surveillance data coming back in to be able to inform decision-making. So utilize feasible entomological surveillance techniques that can minimize public interactions and maintain social distancing rules. And this again is against the backdrop of public health ordinances coming into certain places as well. As well as the advice coming from CARPHA and other public health agencies, letting you know that you want to minimize that gathering, you want to minimize public health interaction. I see we have participants' hands raised there, but we'll take the questions coming in at the end after we get through the session. Yeah. So please feel free to put your questions, any question and answer. If they're technical questions, and then we take them coming into the end. So yeah, so we want to minimize public interaction and maintain social distancing. We want to then practice that from the vector control side of things. So you have workers going into the field, and they have to engage and interact. They have to go out and into the public to do either maybe trapping or level people surveillance, for example. And we want to minimize then their interaction with the general public. We know how the culture is in the region, right? So the vector control workers are very friendly, very familiar to the residents where they go out, and oftentimes the residents want to come out and shake their hands, talk to them, and interact very closely with them. And there's the other side of it where the vector control workers will need to explain when they see breeding, where they find breeding around the yards, and they will need to explain things like that to the homeowner. So we want to try to develop some rules then that help guide the vector control workers where they're in the field, and then supplement that with some other techniques that we can use to minimize that public interaction. We're suggesting then maybe you can use things like traps, OV trapping, if BG Sentinel traps where you have those, the BG guard traps, and minimize the level people collections. The traps can be set up maybe in places that's not private premises, but other buildings like government offices, businesses, where they can minimize the interaction with the public. And if you have to do entomological surveillance and level pupil collections with the public, then we're suggesting that this use of stratified random sampling. So all of this is essentially integrated vector management, but it's integrated vector management with a twist. So we want to utilize stratified random sampling, which is that if you have a large heterogeneous area, so for example, you divide a country into counties, each of the counties are heterogeneous. And within those heterogeneous areas, they are homogeneous blocks. So we can divide the counties into homogeneous blocks and then random sample. So we're moving away from the house to house inspections, where you do every single house on a block. And we've been fortunate earlier this year with the VBD department here at CARPHA to work with about 3 countries under the European Union project that Laura Lee mentioned earlier to develop integrated vector management strategies, including things like stratified random sampling. But we're always available for assistance if you need to reach out to us to get some more clarification on that. Step two is looking at the fieldwork risk assessment, because we have to get out there in the field. There's no choice sometimes. We need to go out there and do the entomological surveillance or the trapping. And therefore, we need to do a proper risk assessment. So we have to look at the different types of work that you're potentially going to engage in the field, and then check to see if you have the requisite personal protective equipment, PPEs for the field workers. Do you have water and soap to wash hands, masks, gloves? A lot of the teams move around with alcohol, 70% alcohol, for example, or similar agent to sanitize hands. And this is very, very important because of the COVID-19 spread, right? And this would apply specifically to those involved in the premise inspections and the vector control personnel that's going out there to do trap servicing and trap maintenance. We're also suggesting that you revise the protocols for community engagement with physical distancing concepts in mind. So when you're going out to do entomological surveillance, if you're going to do larval pupil collections and you're doing inspections around persons' houses, let them stand on the veranda and talk to you, rather than come down and be in very close proximity to you. Yeah. So try to adapt the field protocols that you normally use to get that physical distancing integrated into the system. Premise inspections should be strictly limited to the external environment, and I know very few places still do internal inspection, but we're suggesting then that this time around it's strictly the external environment if you're looking to do larval pupil surveys. Extremely important, we think, is the sensitization session, because we could sit here and develop all of these recommendations and all of these guidelines, all of these rules for interaction with the public. But it's very important that you get the vector control workers sensitized to these rules. And it doesn't have to be in a close proximity session like what you see on the screen there because of the COVID-19. You know, you can do it remotely. You can do it with less persons around, right? You can do it virtually as we're doing now through Zoom. Highlight the rules and adapt the logistics of the new premise inspection protocols, the new trapping protocols, based on the country's culture and nuances. And each country is different. We always say that, you know, the culture in every single Caribbean island, although we're one Caribbean people, the culture in each island is relatively different. So you would know best then how to adapt your rules. Consider the public health ordinances also, because these are laws that are implemented by the country, and what we're giving here is recommendations to work with those public health ordinances that would have been passed by your particular country. Step 3 is looking at transportation and field logistics. So you're going out to the field, and we need to assess then the field transportation situation based on the seating density per vehicle and the spacing of the workers in the field. So I'll take the first one, the first part of that, which is the seating density on the vehicle. So if you look on the slide, there are two different types of vehicles here. One is a pickup truck, which we usually use to mount things like ULV machines or thermal foggers to carry large pieces of equipment in the field. And this usually would seat about 3 or 4 plus the driver. And with the COVID-19 situation, you may want to consider cutting that number down. So maybe just having one person per window, I think, was one of the suggestions in trying to work out how many persons per vehicle. But you definitely don't want to have an overcrowded vehicle. The second example is the one below, which is the bus type, which carries between 12 and 14 persons out in the field. Again, you don't want to have that number of vector control workers piled into a vehicle going out into the field. So you might want to consider doing, maybe if you have a large number of vector control workers, then doing several trips from the home base to the field site rather than one trip. You might want to then work singly rather than in pairs, and making sure, of course, that all the vector control workers have the requisite PPE, as we discussed before. They're wearing masks and sanitizing hands, social distancing. Carry the necessary, if you have vehicles going out into the field, carry the necessary equipment, sanitizing agents on the vehicles that go out into the field. So for example, water and soap to wash hands, sanitizers, alcohol, etc. Right? Again, this would be country specific, and they would need to be assessed based on each country's resources. The fourth step is to look at the mosquito population infestation and the adult mosquito population infestation, sorry. So we spoke a lot about earlier the larval pupil surveys, doing trapping, doing OV trapping. The BG sentinel traps would help, and the BG guard traps would help in determining some of these adult mosquito populations. And here I'm getting into doing adulticiding. So we're recommending that, during the COVID-19 pandemic, that this should be used, these fogging and spraying operations should be an absolute last resort for controlling Aedes aegypti populations. And our rationale for this is that COVID-19 is a respiratory type disease. In the past, when vector control would operate fogging and spraying schedules, we would always be sensitive to persons who suffer with respiratory diseases such as asthma. And I think this should be treated no differently, except now that it's a little bit more complicated. In certain countries, persons are quarantining at home, they're self-quarantining, or they have quarantine facilities, several quarantine facilities around that's housing persons with this respiratory ailment. It's like how you would normally treat a hospital or a health center. You don't want to go around there with a fogging machine, right? So use entomological surveillance and to target the areas with the high indices. If you have to, ensure that the proper use of mass communication, publish fogging schedules, make sure that the areas, the public is very well aware that you're going to come out there with a machine. The fourth point here is very important as well, to carefully choose the type of equipment that you're going to use. There are big differences between using a truck-mounted ULV machine to using a truck-mounted thermal fogger or using a handheld thermal fogger. Those produce very, very different types of, those are very different types of application method, and therefore the fog will behave differently under different conditions and therefore affect your population, your human population very differently. And again, consider the areas of quarantine, consider where you have hospitals and health centers, for example. The step 5, or the public health education campaigns, and like Laurel, I'm also very pro public health, public education campaigns. The key message here is that it's very important that during this time, the public is aware of the threat of arboviral disease outbreak, that it still exists as we enter the rainy season, and that you should utilize the mass communication channels that you have for dissemination of the health messages. And we want to also minimize the risk to the health control workers by limiting direct public engagement. So I'll leave you here with some general advice. And our general advice is to focus on your efforts on the known hotspot areas for arboviral disease outbreaks, emphasizing source reduction and education. Yeah, and this will come from things like doing your stratified random sampling and not having to go house to house to do your entomological surveillance. It may be useful to develop some fun cleanup or source reduction exercises that capitalize on the stay-at-home interventions, right? So the persons at home, and we've seen throughout our members, it's some very bright, very creative persons who come up with very, very nice puzzles and messages and activities that relate to vector and vector control. Ensure that the entomological surveillance operations continue to operate within the framework of any established country-specific IVM program. And this is also very important, maintaining your integrated vector management program while you have this COVID-19 pandemic happening. Ensure that vector control works very closely with the labs and the epidemiology units to increase the response time for suspected and confirmed arboviral cases. So you want to get out there, you want to get to the suspected and confirmed arboviral cases as quickly as possible and do your surveillance operations in the area and do the vector control treatments, because we really, really do not want a situation where we have dengue and other arboviral diseases who are circulating with COVID-19. It's going to be very bad, very, very bad. Continue the public health education campaigns and find creative ways of navigating the COVID-19 messages. And this last point, I mean, we have difficulty in navigating the whole mass communication media, especially when it's been bombarded by COVID-19 messages, right? So we need to find some creative ways then of getting our messages through vector control, vector control messages through the mass communication channels while we have all these COVID-19 messages happening. Yeah. So at this point, I'll just say thank you all very much for giving me a listening ear. And at this point, I will hand over to Sheena so that we can go through the question and answer forum.
Great. So we do have some questions in the Q&A section. We will address at least one live with you right now. Henrietta Alexander asks, is it advisable to use a cold fogger as opposed to the thermal fogger if you do have to fog?
Yeah, that's an excellent question, Henrietta. My recommendation would be in case cases like this with COVID-19 circulation, yes, the ULV machines give a much different type of fog to, well, it's a spray more than a fog. And I think the reach with that is a little better in terms of its coverage, being able to cover the areas and not having to use that very thick fog, I think would be advisable. So yes, ULV rather than thermal fogging.
Okay, great. Vishal Ramprasad asks, what about a roster and shift system for field workers?
Yeah, that's a very, very good question, and that I think we can include that in the guidelines and the recommendations, because we're talking about social distancing, we're talking about reducing the numbers of field workers going out into the field, reducing the density of the workers on the vehicles, and if a shift system helps in reducing that density of field workers that actually go out into the field at any one point in time, then definitely, yes.
Great, and perhaps we can just do one more and then we'll move on to the next panelist. Edward Cunningham asks, how do we get more info on the methodology used for stratified random sampling?
Okay, that's not a problem at all. If you can just send us an email, either Laurelie or myself, you can send us an email at the Vector-Borne Diseases Unit, and we will be happy to provide an explanation of how you go about doing stratified random sampling. We could work with you to find out what your system is right now, and then how we can modify the system based on stratified random sampling.
Okay, you want to do another, or shall we move on to Pete?
All right, so let's move on to Pete, Sheena, and we can probably address the rest of questions at the end. So we'll come back and address them there. Okay, thank you all very much.
Great. All right, so as Raj mentioned, keep the questions coming in the Q&A section. Any technical queries you all have for the panelists, you can place those there and we will get to them as best we can today and follow up accordingly. I'm also seeing that there are some hands raised among the attendees. So you can also just put your questions, if they're technical questions, in the Q&A section. If it's a non-technical question, you can just use the chat feature and we can answer those for you. But we'll move on to our next presenter. It's Mr. Peter Williams. Peter Williams has a Master of Public Health from Tulane University. He worked in Liberia during the Ebola outbreak in 2014 and in Atlanta in support of South American countries during the Zika outbreak in 2016. Additionally, he was a member of the emergency response teams in Haiti after the earthquake in 2010 and in Houston after Hurricane Harvey in 2017. He has also worked to develop and strengthen hospitals, healthcare facilities, and community health programs in the Gambia, India, and Honduras. Peter is currently with the Caribbean Public Health Agency as a technical officer concentrating in infectious diseases and emergency response. He has been supporting CARPHA's COVID-19 response and preparing for responses to natural disasters and outbreaks that may impact the region. So now I give you over to Pete.
Hi, good afternoon. I'm glad you all are able to attend. I'm going to be moving on to talking about a multi-hazard approach to outbreak and disaster management. There we go. So what is a multi-hazard approach? A multi-hazard approach is really a balancing act. It's taking all the priorities that are coming in, all the requests that may be disparate from different sources, and prioritizing them and needing to know which are the most important, which need to take precedence, and then which can come next, so that you're able to keep everything in balance, and hopefully none of your balls all fall to the ground. And just as a way to think about it, basically all emergencies, or most emergencies, not all, really become a multi-hazard and require a multi-hazard approach. So just keep that in mind, that a hurricane, for example, might hit, and then afterwards all of the rain causes a lot of flooding, and so that becomes into a multi-hazard, or just other things that happen as follow-on events really make you need to keep that as the way that you view an emergency. So oops. Let's go back up. So how does COVID-19 pandemic prime us for a multi-hazard situation? First of all, governments are going to be called on to make really complex decisions, balancing between the COVID-19 risks and protocols that we've been talking about, and all the ways that we know to prevent and stop the spread, with all of the disaster response and recovery operations that we may already know, that we've already experienced. So it's balancing those two, and so we've already got one thing going on, and now we're going to start piling these other things. So COVID has also taken over a lot of work of the ministries of health throughout the region and throughout the world, really. And so they've not been spending the time on other things that they might have normally. And so in some ways, that's going to put us in a precarious spot, possibly. Also, now we could be seeing over the next few months the results of not being able to spend time on some of the other public health campaigns that we might normally do, and the other actions that we might take for public health. Outbreaks in the past can cause and have caused losses where countries have seen gains. In Liberia, during the Ebola outbreak, they had been working for the last 10 years to really build up their maternal and child health programs, and they saw most of those gains lost due to that outbreak, and we can see that in other situations as well. So I think that we'll see some knock-on effects from COVID-19 as well. Additionally, we just have to learn how to do everything that we already knew how to do now with these new protocols under this new paradigm that we're acting. So why does it matter? Why is this important? It's because reducing risk mitigation members can cause future risks relating to COVID-19, and we've seen that happen. We've seen that in repatriation. We've seen that as education efforts start up again, and as countries do economic stimulation, especially here in the region, as we try to return to the tourism that has been really great for the region. But we can see this throughout the world as they've relaxed different measures. We see spikes and increases. Also, it's predicted that there will be greater COVID-19 infection rates following a natural disaster event. That's been predicted by a number of experts, and we're poised and ready for that to happen. So, excuse me, keeping and even increasing COVID-19 countermeasures now in advance of these natural hazards will help to inform your preparedness strategies, but also reduce risk during and after the event. If we can get those numbers down and keep them down, and keep these mitigation measures in place, then it will put us in a better place when a disaster does happen. So how do you do a multi-hazard approach? What's involved in that? The three big parts I would bring out are planning, exercises, and preparation. Planning should take a look at your at your old plans. Look at last year's plans. Look at how your response worked. Look at what didn't work. Look at what went well and how you need to improve that. And then also look at how you need things that you need to add so that you can keep the COVID-19 mitigation strategies in place. Next, start having exercises. Hold tabletop exercises so that you can understand how all the parts work. So you have all the people together and talking about it. It helps with planning, but it also helps to get outside advice too. CARPHA, SEDIMA, RSS, I've seen a lot of these different organizations. CARELAC was doing simulations to talk about how everybody needs to update their planning and look at what their plans are and how they're going to evolve and change in this new paradigm. And then take the time to do real life walkthroughs of the different areas that you'll be using. Take a look at your shelters, get them ready, figure out how admissions is going to work and how people are going to move through. How are you going to isolate and quarantine? Are you going to have certain shelters for people that are known to have COVID, and then shelters for people that may or may not have been exposed? So think through those things. Walk through your healthcare facilities. How are they going to take in patients? How are they going to take in surges and be able to keep their patients and staff safe from what's going on with COVID? Look at your EOCs. Are they able to hold the capacity that you need? Are they able to keep people at the safe distance? Or do you need to add in rooms, and do you need to rethink how those are configured? Have walkthroughs of your power stations and your utility providers. How are they going to be able to do the repairs that they need to do after a hurricane or an earthquake and still be able to keep themselves and their staff safe? And then last, for preparation, start procuring and distributing the PPE and other workforce protective measures that are needed for people in the field. Get those pre-staged, get stocks in separate areas in case one might be inundated with weather or lost due to one reason or another. Get your plans that you've got ready from your planning and your exercises and distribute them. Make sure that all of the actors know what they need to do and how they need to be ready. And then last, attend our webinars. Attend SEDIMA or WHO or PAHO or CDC. There's a lot of webinars that are going on that you can attend and find more information to get ready. A few response areas to consider. I just talked about a few, but think about how is disaster relief and recovery operations going to happen right after that initial impact? How are you going to do evacuations and both the operations and the protocols? How are you going to keep people safe in those situations? How are you going to do search and rescue operations, maintaining COVID-19 standards? Shelter management, I talked a little bit about. Medical support, quarantine and isolation requirements. Walk through those and make sure that they're ready. Think through how you're going to do continued humanitarian assistance and relief and distribution of food and other sundry supplies. So all of those are things to consider and rethink how you need to do them in the current situation. So talked a little bit about general disasters and COVID-19, but now specifically, how might your mosquito-borne disease management change after a disaster in a COVID-19 world? So we're really piling them on here. Why is it important to think about this? The habitats of the mosquitoes are going to be destroyed. They're going to be out looking for new places to live, and they're going to be looking for new places to feed. You don't want to lose the gains that you've had on prevention and eradication over the last year and the last couple of years. So you want to make sure that those losses don't happen and make sure that you're keeping up with these things. And then think about also that continuing recovery efforts might impact how you're going to be able to do your programs. Recognizing that it's not just right after the hurricane, but What about people that are continually experiencing homelessness because of destruction? Even if it's a low level storm, it may cause a number of people to become homeless. And so continuing recovering efforts are going to impact how you do the mosquito-borne diseases. How is it different? Like I said, you may not have been giving the mosquito-borne diseases the attention they might normally have gotten in these preceding months, in these last couple 8-9 months. So that you might already have higher populations of mosquitoes than you might have in the past. You're going to have, after a disaster, fewer resources available. Some might be diverted because you might already have had people diverted to the COVID-19 response, and then now there's a disaster and you might lose more people for a disaster response as well. So you might have fewer people, or your resources might be diverted to other things, your trucks, things like that. But also things might have been destroyed or lost in whatever the event was. If it was an earthquake or a fire or a hurricane, the building where things were stored might have been destroyed. So you may have lost those resources. Your infrastructure might be overwhelmed, so you're going to have to figure out, how to get to the areas that you might not be able to get to anymore. You might normally have been able to drive there quite easily, and now you can't get to where the mosquitoes most commonly were. And then again, it's a lesser priority. I talked about the balancing act. For a few days, for a few weeks, all the efforts might go directly to the response efforts and the recovery, but the longer that goes, the more you're going to need to make sure that you're not losing those gains and it doesn't become too much of a lower priority. So how do you do it? How do you do mosquito-borne disease control after a disaster event? I'm going to suggest that you might need to update some of your methods, and you might need to even rethink and change some of the priority of your interventions. So first of all, you want to think about, does your messaging make sense in the context in which the people are living? If people are in a shelter or in a tent, does it make sense to show them pictures of people sleeping under a mosquito net or screens on the door and the windows? You can't tell them to empty the flower pots of water if their house was flooded and their whole house is now basically an insectarium. So you wanna make sure that your messaging is gonna strike home and really be appropriate to the context that people are in. And then temporary housing can make education efforts harder. It might be harder to find the right people in the stage that you're trying to reach them. So you're going to have to rethink how you're doing that education efforts. And then also you want to rethink about the safety of, can you go to a camp of internally displaced persons, or are you able to go into communities where things might be unsafe, where structures might not be as sound as they were. So you need to rethink how you're going to reach the people. And then lastly, you want to change the priority of your interventions. Though Raj spoke about the environmental spraying being a lower priority, you might need to make that a higher priority in some places, of course, giving consideration to the effect that it would have on people. But if a community or an area has become somewhat uninhabitable, you may need to consider spraying as a way to control those populations. And then I would suggest that entomological surveillance probably may become harder to some extent, but probably becomes more important, so that you're making sure that you're putting your people and resources, which are even more limited under these situations, you're putting them in the right places. Okay, so that's a quick survey of doing mosquito-borne disease control after a disaster in a COVID-19 world. So I'm going to hand it back to Sheena, who's going to moderate some questions for us. I'm sure lots have been coming in. Thank you for your attention.
Okay, great. Thank you, Peter. So we'll go back to the Q&A. I know that Rajesh and Dr. Boodram would have been answering some of the questions as well, typed answers to any questions that might have come in. So it could be good for all to review that Q&A section to see if your question has been asked and, more importantly, if it's been answered in that section. So some of the questions that remain, reports indicate that some regional governments have been considering alternative control techniques such as sterile insect techniques. Is there any plan by CARPHA to engage regional countries in research projects such as SIT? What advice regarding the process do you have for any country considering such?
Hi, good.
Laura Lee, we're not hearing you if you are answering. Okay.
Okay, thanks, Sheena. I'm back on. So with respect to the query on sterile insect technology, yes, CARPHA, in addition to some of our regional partners, including our countries and international partners as well, there has been much interest in sterile insect technology, and there has been some preliminary work and training conducted in the region for member states through the IAEA. What we do, however, recommend, as Mr. Wilmer was asking, is that before we realistically consider implementing such a technology, each country has to conduct a feasibility study. All right, we need to determine that moving forward into the future, yes, we may, if there's a donor involved, we may be able to receive the funds to do a startup and a pilot, etc. But bearing in mind sustainability aspects, will there be available human and financial resources that can actually sustain this technology as a measure in the future? The other area to consider is the community aspect. Right, these changes in these new technologies are usually, they are a little bit hard to absorb by the community, and there has to be a lot of community outreach. They have to be well informed and able to understand what the technology involves in order to be able to accept it and buy into it. So those are some of the major factors that you need to consider before you look at this particular type of technology.
Okay, great. And that's all the questions we have in the Q&A, but I do see that we have one from Dr. Fletcher-Lottie in the chat. She would like to know what would be the role of VBD staff in search and rescue and evacuation.
Mr. Williams will answer that one.
Thank you, Stephanie. That's an interesting question. I would say that for search and rescue, you really want to make sure that the people are properly trained as best as possible. So if they're properly trained and in your system, I think that they would probably be a great resource as they probably know the terrain well. They've probably been traveling quite a bit. So I would think they would be a great resource, a great source of people to bring in, as well as you can, as long as you can train them and get them ready to do that. So both, that would be for the search and rescue. For the evacuation part, I would say that's a great resource of people that know the communities and know the area. So great question. Thank you for that. Anything more, Sheena?
There is one more I see here. Well, two more actually. So Marie-Louise Lewis, in terms of Dominica, are you aware of any campaigns in relation to site inspections and frequency of these inspections? I'm sorry if I did not get the pronunciation of your name right. You're muted, Pete. Oh.
We'll handle that one on the chat.
Okay. Okay, great. Marquita Gittens asks, what types of research is the program supporting? Would IVB monitoring and evaluation research be included?
Marquita, we'll follow up with you in just a second as well for some clarification on that.
In the interim though, all the attendees, I just want to draw your attention to what's on the screen right now. So there is the survey that's going to go out. I'll actually put it up in the chat as well. We ask that all feedback on the presentation on today's webinar be given through that means. And then, as I mentioned in the beginning, once you complete the survey, which is completely anonymous, you will be guided to another link to put in your information to receive certificates of participation for today's session. So, getting a little some feedback on those two previous questions which were asked. There's one more question too, if the panel is available to take it. Rajesh, are you available to answer one more question?
Sure, Sheena, go ahead and send it.
Okay, so with the advent of COVID-19 and the need for social distancing, how does the constant use of chemical applications to control the adult mosquito population affect the human aspect and the possible mutation of the mosquito ecology?
Okay, so okay, so just trying to get a sense of what the question was required from the question. How does the constant use of chemical application to control the adult mosquito population affect the human aspect and possible mutation of? Okay, so we've been looking at chemical application, the use of chemical application throughout the Caribbean, and an example of that and the effect on, I'll take the latter first, on the mosquito itself, and the mutations in the way that the mosquito responds to the chemical. It's tested using our insecticide resistance testing protocols. So we've been looking at different mosquito populations across the Caribbean region to see if they're becoming resistant to particular chemicals based on which chemicals are being used in the country, the frequency of application, the concentration of the chemicals that are being used in the country, for example. And so we have a good idea of the insecticide resistance profile of several of the countries in the region. We have noted that constant use of particular types of chemicals have caused certain mutations that cause the mosquitoes to become resistant to the chemical, and where we have recently been looking at the biomolecular side of testing to identify exactly the genes responsible, which genes are being mutated and which genes are responsible for resistance in the mosquitoes. As it relates to persons, the point is that the constant use of chemical application, I think, we should not be using fogging and spraying, as a frequent intervention measure to be able to control mosquito populations. I think if you note that it happens in a lot of countries where persons will complain just after you pass and you would spray a particular chemical, spray for mosquitoes or fog, people would say that they're getting bitten the day after, or hours after, a day or two after, and it really speaks to the lack of source reduction. And if you spray, essentially you're knocking down the adults, but then there are large reservoirs of juvenile stages, larvae and pupae that are ready to emerge. So we don't recommend then the use of fogging and spraying as a frequent intervention measure. Yeah, Sheena?
Thank you, Raj. Lisa Shaw asks, what are the protocols for fogging an area in case persons living in the area may have respiratory illnesses?
Okay, so usually the vector control departments would liaise very, very closely with the areas of Ministry of Health to be able to identify then where you might have, in the cases of COVID-19 quarantine centers and all that, then they would have an idea of where those persons are. With other respiratory diseases like asthma, for example, you may or may not know where these persons reside. So this is the importance then of having the fogging schedules being published. Some places use a mic and they would pass, around the particular areas to be sprayed 24, 48 hours before, and let the persons know that they're going to be coming around with a machine, so that they can take the necessary precautions to protect themselves. Yeah.
Okay, thank you, Raj. I think that is it. It's as though you answered all the others for now. So
I'm seeing one here from, okay, I'm just seeing one here from Maria. Maria Henry is asking, can Rajesh give an example of using entomological surveillance techniques during the COVID-19 times? So the entomological surveillance techniques we're referring to here, part of the integrated vector management program, including things like stratified random sampling, the use of UV trapping to reduce public interaction, also the use of other types of adult mosquito traps like BG sentinel traps, BG guard traps. I think those entomological surveillance techniques should complement what you do in the field. And they go a long way into giving you that entomological indices that you need to be able to get actionable data rather than doing a house-to-house inspection. All right.
yes, Raj and team. Tika Ramlogan asks, what are recommended chemicals that can be used for using mist blower applications for mosquito control?
So, okay, so chemical application should always be done alongside resistance testing, insecticide resistance testing. Usually most countries have a choice of chemical that they already use in their machines, whether they use in a ULV machine, and they use things like malathion, for example, or some type of permethrin, pyrethroid, or they use a thermal fogger and use similar chemicals in the thermal fogger. So it depends then on the country's choice of chemical, what they've been using, and in fact, what they have access to in the vector control program. But it should always be done alongside an insecticide resistance testing program where we can then guide the efficacy of those types of chemicals and chemical usage in the field, because you don't want to be wasting resources spraying and then it's not effective. Yeah. Right, Sheena, so I'm going to hand over to Dr. Boodram. Sheena.
Yes, I'm here.
Okay, Sheena, I think you can probably go ahead and close off.
Great. Everyone just note though, any questions that came in here, we will take note of and do our best to reach out and respond to those questions. Just to point your attention to the chat, I've put the survey in there for all to complete at your convenience. The link will be available for the next few days, so please get those responses in within the next 7 days, I believe it'll be available for. So thank you so much for joining us today, for coming and participating, and for all the questions asked. These questions were all great, and we encourage you to continue this conversation past today's webinar. If you require any additional support with your programs, we are here to help you as best we can. As I mentioned in the chat, you will find the link to the evaluation survey. You will also receive it in your email as a follow-up to your participation today. On completing the survey, you will see there's a thank you page with another link that then goes on to a Google form. And that is where you'll put in all the information. You log your name and address, and for the certificate of participation to be completed and sent. So your certificate will be emailed to you within a week from now, once you complete that Google form. So I know a couple of people also asked throughout the presentation about the availability of it. The recording will also be made available within the next few days. So thank you very much for your time and attendance today, and we hope to see you at our future events in the series. Have a great day, everyone.